Dennis Thomas O'Connor, now 75 years old, talks about the health problems he's had. They include heart disease, prostate cancer, and being very overweight. But he was lucky to meet the right doctor and learn about the tools he could use to take control of his health.
And it gave me a sense of empowerment, gave me a sense of knowing what to do and think about my health. And getting this feedback on a constant basis I feel it's just tuned me in to a point where I'm no longer in denial. I no longer ignore, symptoms, just the opposite.
O'Connor's toolkit includes a Fitbit, an Oura Ring that monitors sleep and body temperature, an Apple Watch, and a cardio monitor, which can give his heart an EKG at home. He monitors his health daily, and the graphed data from his monitor shows up on the computer screen of his doctor, Michael Kurisu. Kurisu is founder of a virtual clinic called Measured Wellness, which he runs out of his Carlsbad home. He remembers when he started seeing patients.
So the typical patient from that small cohort that started were patients who were somewhat the medical system had no answers for them, and they had to kind of go and do it on their own, whether they were dealing with, different types of cancers or some other chronic illnesses, and they're just meeting roadblocks in the traditional medical world, and they wanted to learn more about themselves.
When he talks about his patients, Kurisu says they have a partnership. It's not a hierarchy with a doctor at the top. He says his patients share a strong motivation to take charge of their health, and it's not incorrect to call it do-it-yourself medicine.
It's just like the Home Depot. It's like, well, not going to get the plumber to come to do it myself. I'm going to learn how to do this myself. And there's a lot of learning in that.
Here's another way to look at it. Benjamin Smarr compares it to the Protestant Reformation and the Catholic Church, which only published the Bible in Latin that only the clergy understood.
You had to know Latin, which meant you had to go ask the priest, what should I do? And Protestantism came out of this idea that if the Bible was translated into the vernacular, locally everybody could read their Bible and figure out what do they want to do as a community. I think this is a really interesting parallel to what we're seeing in medicine these days.
Smarr is a professor at UC San Diego who splits his time between bioengineering and data science. Students in Smarr's lab have analyzed some of the data collected by Kurisu's patients. They look for patterns and spikes that could indicate poor health. Smarr says medicine's old priesthood, the doctors, are entering a new relationship with patients, and he hopes that relationship will be supportive and respectful.
The expectation that a doctor just magically knows the right answer for everything is totally unfair. That's not how we treat any other person. Expecting that they have an expertise and that they could contribute and that we could together augment and make a better decision, I think that's a much healthier relationship.
I'm wearing one on mine right here.
When you are monitoring your health hour by hour, Kurisu says the effects on your body can be known to people very quickly.
You can see how certain foods affect you, right? You can, eat pizza, see what happens to your blood glucose.
Stress is often seen in patient graphs.
The third Tuesday of every month, one of my patients says all of his data was just crashing all the time. Like, it was like, wow, your heart rate's going down, like your glucose is all over the place, your sleep was terrible. It became a pattern. And so data scientists are really good at looking at these pattern recognition. Like, well, what happened Tuesdays? You're like, well, that's when my mother-in-law comes in the house to take care of the kids.
Patients who monitor themselves have to make the time to do it, and they have to be motivated. Kurisu's patient, Dennis O'Connor, says he wasn't always motivated, but that changed after he had heart surgery and had to get 2 stents in his arteries.
I was near dying. Okay, and 2 years before that, I'd had prostate surgery, and I've been hit with this fear of death, and that did wake me up.
That's when he started really looking at his health using today's technology, and since then, he has lost 65 pounds. Thomas Fudge, KPBS News.